attempt with technical difficulties. So let's try this now. If you're watching this, you probably don't feel well. You wouldn't be here if things were great. So you're either already diagnosed with something and you want to know what you can do about it, or you're in a state of I don't feel good-itis and you've been told everything is fine. Either way, you want answers and you want to know what to do to get better. And there's so many things out there, right? I mean, there's detox protocols and mold tests and vitamins and supplements and hormone testing. Where do I start? That seems to be the question. Where do I start? So if you've been on this journey for more than 2 minutes, you know that there is so much out there. How do you know where to start? Do you get blood work? Do you get mold testing? Do you get hormone testing? Make it make sense. So today's episode is about helping you through the maze. I'm not selling you anything or telling you what supplements to take. I'm just giving you a map. I wrote a whole book about it. It's right here. It's called It's in Your Head. But I'm not even selling you that. I'm giving you the cliff notes of what's already a pretty short book. Because what could be better than a shortcut to a shortcut? So let's get started. If you're watching us on live, God bless you because we've already had so many technical difficulties. Let us know that you're here. Say the word live. We'd love to hear from you. If you're watching us on the replay, type in the word replay. It lets our team know that you're here. Ask us any question that you want. It does not have to be about this. Of course, if you're listening on YouTube, let's go. Like and subscribe. Don't be lazy. Help us out. And if you're on the podcast, I'm wearing a gray sweatshirt and my cat is on my lap. So other than that, you're not missing anything. And if you're not following me on TikTok, you should, because I put a lot of information out on TikTok. And if you're not watching me on Instagram, you should, because that's where it gets funny. And anyway, back to our episode. I decided to do this episode because so many people don't know where to start. And I don't blame them. It's so overwhelming. And so before we even say where to start, I want to say there's 4 categories of people that come my way. See which one of this is you. There is the I don't feel good-itis crew. Maybe you're tired, you find yourself dragging, you're not sleeping well. Things are just not as they used to be. And you go to your doc and they say, the labs are fine. This is just a normal part of aging. Or what do you expect? You're stressed. What do you expect? You're older. You're a mom. You're this, you're that, right? That's the I don't feel good-itis crew. Second crew is the crew that's maybe given a diagnosis. Maybe you have diabetes, maybe you have hypertension. And they say, hey, take these meds. We'll see you in a few months to monitor, monitor, refill, end of conversation. You're fine. Group number 3, maybe you have a more complicated diagnosis. Maybe you have an autoimmune issue. You get some flare-ups. You have good days, you have bad days. You have multiple specialists. Each one manages a different body part. You have the one guy that does the GI, the other one manages your joints, another one for your skin. And no one offers a conversation that, hey, maybe this is all connected. Like maybe one part of your body actually affects the other part of your body. But no, that can't be because you have 2 different specialists in 2 different offices who never talk to each other. And that's totally fine. And the 4th group is the people who are really feeling okay, but you're worried about how to optimize your health because you want to prevent, and you go to the PCP and you're like, hey, I get it, I'm feeling good. I get it, my labs are good. But like, is there anything I could do to make sure that, I'm good in my later years, my golden years? And I'm like, no, as long as your annual is fine, you're fine, right? So if you're one of these 4, you're in the right place. And here's what I want to tell you. None of this is fine. It's not fine. It's not fine not to feel well and not know why. It's not fine to just take meds and not have a backup action plan of how do we get off these meds. It's not fine to have 12 different specialists, like your body isn't connected. And it's not fine not to have a prevention plan for things that for the future, even though things are going okay right now. The bottom line is it is not fine. None of it is fine. But before we go on, I do need to say this. What all 4 groups of people have in common is that every single one of them first went to a doctor, an NP, a PA, to get evaluated. You have to first start with your PCP. Even if you get no answers or partial answers, do not skip this step. This episode is not for you if you've never been to a medical provider. If you're not feeling well and you've never had blood work or imaging or a visit with a doctor NPPA, shut this episode off, go make an appointment, because you must start there. Do not diagnose yourself based on this episode or anything that you hear on the world wide interweb, okay? The patients I work with already had a million tests, images, appointments. They come to me when they don't know what to do next. I'm not saying I'm smarter than any of your current medical providers. They are all amazing and smart and caring people. I just have a different approach. I have a skill set to see how things are connected. I have a gift of being able to take all the information that you've gathered along the years and make it make sense. I connect the dots and then I help you create a plan. Now, of course, when you work with me, it's all customized to what's going on in your life, but there is a basic framework that I use as a guide. And today I'm sharing that framework with you so that you know how to start. Now, for those of you who don't know me, you need to know how I got into this whole craziness because my story is your story. You need to understand that I went to school, I became an FNP, that's family nurse practitioner, and I opened up my own practice called EG Healthcare. And I was living the dream. I have a great primary care practice. We see over 20,000 patients. My schedule's full. The practice is thriving. Everything is fine. And I could have just kept going on with that. But instead, I went back to school and started all over again. I had to learn so many new things, and I had to unlearn so many things. And I had to face ridicule by some of my colleagues who think this is all quackery. And why did I do it? Why do any of us, like crazy medical providers, go back into school and study functional medicine? Why do any of you listening right now going down this rabbit hole? Like, why are you here? I'm sure so many of you kind of still wish you didn't know what you know right now. And the answer is because the system failed us. We are all here because we either got sick or someone in our life got sick and conventional medicine was not enough. Now, don't get me wrong. I am not against conventional medicine. I love it. I still practice it. But I now recognize its limits. And it started when my wife was diagnosed with two intense autoimmune issues. The first was PMLE, polymorphous light eruption, which is basically an allergy to the sun, and psoriasis. And the first one took her years to get diagnosed, and she had to give up her career because of it. It was so debilitating. And the second one, psoriasis, was so severe that she could not walk without having her skin crack and bleed. And all that was offered to us at the time was heavy-duty medication. And we just knew that there had to be something else. P.S. That's why we call it the new method, because you always know inside. My patients know, you know, that's why you're here. So we started digging. And you have to remember, I'm old, so the internet was not like now. So digging was a little bit harder. Someone told us about this crazy thing called functional medicine, and we decided to try it. And we did. And it worked. Her autoimmune calmed down. We got our lives back. So I knew I had to bring this to more people. But I didn't even know where to start. So I started taking courses, right? And there's so much information everywhere. The learning never ends. I'm still learning. Eventually, I got my PhD in integrative medicine, and I created the new method. And it created a system, a framework that I use with my patients. Though each patient is different and needs different customization, there is a framework, and this is what I'm going to show you right now. So where do we start? I know I said it before, but you must start with your PCP first. And make sure you go to every specialist they recommend and do all the images. And you might say, but you just told me conventional medicine failed you. Like, why would I start there? Because you have to use all of the tools, not just one tool. And just like conventional medicine has its limits, functional medicine has its limits too. Everything has a limit. You need all of the tools. And it's critical that you get some basic labs and images so that we know what we're dealing with and what we're not dealing with. Like, for example, you could be tired, right? Tired is a common complaint. Maybe it's adrenal fatigue, but maybe it's severe anemia. Maybe it's cancer, right? So you need to make sure you get some basic labs before you consider functional medicine. So start at your PCPs. That's where you start. Now, if you get a diagnosis, great. We know what to do. We have somewhere to start. And if there's no diagnosis after seeing 27 providers, don't get frustrated. It doesn't mean that your doc doesn't know what they're doing. It just means you don't have a diagnosis yet. Okay, it just means you have to come and search a little bit more. And if you're feeling really yucky and no one in conventional medicine can find out why, that's actually a blessing. Don't get frustrated. You just use one tool, and now it's time to move on to the next tool. And for those of you who have a diagnosis, great, same thing applies to you. You just heard one perspective on your diagnosis. Now it's time to get another perspective. So that was step one. Go to your PCP. Don't get frustrated. Get a list of my diagnosis or being told nothing's wrong with you. So what's step two? Step two is, how do I start feeling better? So you have to focus on the root cause. And the root cause of all health issues is inflammation. We're talking about chronic inflammation over time. It's chronic, and we're not talking about acute inflammation, right? Acute inflammation is something that you need. We're talking about chronic inflammation over time. It triggers everything from I don't feel good-itis all the way to chronic disease. And if you want to feel better, you have to manage your inflammation, okay? Now, I just want to explain, not all inflammation is bad. We need inflammation to stay alive. You get hurt, you get cut, area gets inflamed, it brings healing, and then the inflammation goes away. Okay, that's the kind of inflammation that's good. It comes, it goes, it comes and goes. What we're talking about right now is chronic inflammation that doesn't go away. This type of inflammation drives disease. Inflammation affects everything: your brain, your GI, your skin, your joints, your immune system. So the next question is, what caused my inflammation? Is it mold? Is it Lyme? Is it adrenal fatigue? Is it my hormones? Well, the truth is, it could be all of these or none of these. And your journey is about slowly and methodically ruling each one of these in or out. But there's one place every single person has to start. You have to start with your gut. Now, I'm not saying that everything will go away for every person once we heal the gut, but I am saying that there's no point in looking any further or doing any tests until your gut is on point. You cannot remove inflammation from your body if you're eating inflammatory foods at every meal. So even if you have another source of inflammation, you still have mold, you still have Lyme, you won't even be able to handle the treatment for the mold or the Lyme until your gut is on point. So, treatment for mold and Lyme and other issues, it's hard. It's hard on the GI tract. It's a lot of supplements. It's certain nutrition. It's hard on the liver. So you have to make sure that you're healthy first, as healthy as you can be. So no matter what, you have to start here in the gut. This is where I lose some people, because people want a fancy test with one result that will tell them the one thing that will fix everything. And it doesn't work this way. There are no quick fixes. And anyone who sells you a quick fix is lying. Okay? If you're not feeling well, there's probably more than one reason, and you have to peel away at it layer by layer by layer. So the gut is the main source of inflammation, and it's in charge of everything. It's in charge of your mental health. Like, it makes the neurotransmitters for your brain. It's in charge of your autoimmunity. 70% of your immune system is right here. It's in charge of your hormones. It's in charge of everything. Absolutely nothing is on point if your gut is not on point. Okay? So now here's another part. Some of you might say, oh, this makes a lot of sense. My stomach is bloated all the time. I always have stomach issues. This makes sense, right? This inflammation. But some of you listening might be saying, this can't be right. My stomach never hurts. I don't have gut issues. And I'm just going to go on to the next episode. This lady doesn't know what she's talking about. So I'm here to tell you this. If you don't feel good, you still have gut issues, even if your stomach doesn't hurt. The food you eat may not be causing you stomach pain, but it can be causing your skin issues, your anxiety, your joint issues. Your nutrition may still be causing inflammation in other parts of your body, even if you don't have GI issues. Remember what I told you, the story about my wife and her autoimmunity? Her stomach was fine. She never has belly issues, but her nutrition was still causing her autoimmunity. And this is because something called leaky gut, and you'll get to that episode when you binge watch. So you want to know where to start? This is it. You have to start with nutrition. If you skip this part, the rest will fall apart. If you skip it and say, nah, I'm good, I know I have mold, and you do a mold test, your treatment won't work. You won't be able to handle the treatment. Your hormones will only get you so far. So don't skip this part. So then the next question is, what do I do after I fix my gut? Great question. So many of your symptoms will disappear once you get your nutrition right, right? They will go away. You'll be one of those people who'll be like, this is great. This is all I needed. And I'm going to explain what right nutrition means in a minute. And if it goes away, amazing. You're done. You're good to go. But keep your plate on point. You feel great. No further testing needed. No further questions. Now, some of you will feel better, but you'll still have some symptoms in certain areas. And now is when you can start talking about testing, because now your gut is on point. You got rid of any symptoms that were related to your gut. Your liver is good at detoxing. Your inflammation is lower. And now you could do what you need to do to handle the rest of it. So what test do we do? We'll talk about what test in a second, but let me just tell you what I mean by getting your gut right. There's a 4R protocol. I didn't invent it. I'm just awesome at it. The first part is you have to remove. You have to remove all the junk and anything else that hurts your belly, even if it's not junk, right? So of course you have to get rid of the high fructose corn sugar and the gluten and the dairy and the corn and the soy. But some people might need to eliminate more, because anything else, even though it's on the healthy food list, if it triggers you, you have to remove it, even though you think it's healthy. So some people have to eliminate legumes. Some people have to eliminate eggs. Some people have to eliminate nuts. And this, requires some customization. But at the very least, you need to be gluten, dairy, corn, soy, and sugar free. That's like the most basic start. Remove the offending agent, okay? Replacing is the next part. Like, so many of you are really good about, removing things. I'll just eat grilled chicken and broccoli for the rest of my life, right? So they'll just remove it. But that is not enough. That can actually create new problems. You must also replace. You got the bad stuff out. Now you have to put the good stuff in. So many people remove that stuff but forget to focus on this. You have to look at your plate and purposely put good stuff in there. The green leafy vegetables, the fruits, the colors. The more colors on your plate, the better. You also want to replace some supplements like digestive enzymes. So replacing is really about putting the stuff in that you probably are missing. Then we move on to re-inoculated. Re-inoculated means we add probiotics. Now, you don't want to add probiotics too early, because some people are like, hey, my belly hurts, let me add probiotics. But if it's already a mess and we're just adding more to it, sometimes it makes people feel worse. So I like to add probiotics later on when things are a little bit calmer. So we remove the bad stuff, we put in the good stuff, and now we added some bacteria. The war is calming down, and now we need to consider healing the gut, right? That's repairing. And that's when we start adding some collagen, amino acids, vitamin A, bone broth. We're healing the lining, right? And you should notice that you start feeling better, okay? Now, that being said, some of you might feel a little worse before you feel better. The first week might be pretty rough coming off of this, because that's coming off the standard American diet is like detoxing from a drug. So don't get scared if the first week is really hard. Push through it to the other side, because it's amazing on the other side. Now pay attention to what got better. Did your bloating get better? Is your skin clearer? Are your headaches better? Did the ringing in your ears stop? Are you sleeping through the night? Like, what's happening, okay? So now that you've calmed down your belly, we can start talking about the fancy tests, okay? So what are the fancy tests? The fancy tests really depend on what symptoms you have. So for example, you did all this work and now you're still really, really tired. This might be a time to test for adrenal fatigue, okay? Adrenal fatigue, excuse me. It's a saliva test, and it lets you know what your cortisol levels are doing. I did a whole episode on this. When you binge watch, just find that one. And I use a company called, excuse me, I use a company called Doctors Data, not affiliated. And you do this adrenal test, and it lets you know what's going on with your fatigue. And then you'll add some adrenal support, some supplements for that. If you're really still having belly issues or skin issues, even though you've done this whole 4R protocol, that's a good time to do food sensitivity testing. A company that I like to use, again, not affiliated, it's called Cyrex. They're really good at running food sensitivity tests, which, by the way, is not the same as allergy testing. So this can't be done at your local allergist. If your stomach is still off despite doing this work, you might consider stool testing. A company called Genova does a great test, and this test is for let you know what's happening in your microbiome, what supplements you might be missing. Is there a pathogen in there? So much good information there. If you're still feeling super tired, remember, only after you've done the work. You're still feeling tired. You have brain zaps, internal tremors, sensitivity to chemicals. That is a good time to consider mold testing. The company I use is Real Time Labs. If you still have joint pain and swelling and extreme fatigue after fixing your gut, you might want to consider Lyme and tick-borne testing. I use IGeneX for that. And hormone testing. Now, most people who are not menopausal, postmenopausal, you don't really need hormone testing because usually once you fix the insulin and once you start fixing your belly, the hormones tend to regulate themselves. But for the postmenopausal woman, the reality is you're going to need some hormones. And hormone testing is appropriate here. But again, don't even jump down that bridge, down that road, until you fix your belly first. Okay. So then the next big question people ask me all the time is, what supplements should I take? And the answer is, it really depends on what's going on in your life. There is no one size fits all. So there are 4 basics that I would recommend. And then on top of that, you're going to build depending on what's going on for you. So a really good high quality multivitamin. And yes, I sell it on my website, but get it anywhere. I don't care. Just get it. Omega-3. Omega-3 is like the number 1 anti-inflammatory. It just needs to be in your toolbox for no matter what you're dealing. If you're here, you have inflammation. So get the anti-inflammatory, omega-3, done deal. Vitamin D, because vitamin D is not really a vitamin. It's actually a hormone and it's involved everywhere, like in every process in your body. So get that vitamin D right. And then either glutathione or NAC, which becomes glutathione because this is the master antioxidant. So these 4 things, just basic. That's your foundation. You should have on that. But then it depends what's happening. If you're dealing with mold, you're going to have a whole list of supplements. If you're dealing with Lyme, different supplements. Adrenals, different supplements. So adding on top of that really depends on what's going on for you. So here's the recap. Start with your PCP first. Do not skip that step. If you skip that step, pause, go, and then come back. Go to all the specialists. Do all the labs. Get the images, right? Then you're going to come over to this side, to the dark side. You're going to fix your belly first, 4 R's. You're going to see what symptoms you have left, and then you'll determine what tests to do. If you even need any test, you might not need any test at all. Now, as always, you can work with me and my team one-on-one, and this is how to reach us, or you could do it on your own. Watch my content, read my book. Whatever works for you works for me. No matter what, you're here because you always knew there was a better way. I will see you guys soon.